Hi, good afternoon. We're about to get started, everyone.
Hello.
All right. It looks like everybody's been able to connect. I am so excited today to welcome Martina Michael, and she is an Archer Fellowship graduate. She's going to be presenting today on mental health care access for prenatal and postpartum individuals in the justice system. And it looks like this topic interested a lot of you. It definitely interests me as a pregnant person, and just knowing what that feels like for the first time. So yeah, I'm just gonna hand it over to her and let her tell us a little more about herself and about the topic. Thank you so much.
Thank you, Lisa. Thank you for the introduction. Hopefully the presentation doesn't scare you. Um, but it is a topic that is near and dear to me. And I got the opportunity to research on that topic when I was receiving my master's in public health from UTMB. So shout out to UTMB for allowing us students to go for an Archer Fellowship to DC and work on health policy. So a little bit about me. I'm currently working with the Texas DSHS. I work in the maternal health section. Today's research is not connected with my work there. This is related to my work with the previous fellowship. And I have been looking into maternal and child health for the past 4 to 5 years. Previous to that, I was working as a general physician in rural India, and I was in charge of doing a lot of late night deliveries. I was working as a nocturnist, so I would like to say that my interest in maternal and child health stems from there. And I hope you find the presentation informative and eye-catching. Let me share my slides. Are you able to see my slides?
Looks perfect. Thank you.
Oh. So welcome everybody. Today's topic is mental health care access for prenatal and postpartum individuals in the justice system. So let's imagine a young woman named Sarah who is 5 months pregnant. And this individual has recently been incarcerated for a nonviolent offense. In the United States, a nonviolent offense can range anywhere between a speeding ticket, DUI, to tax evasion and fraud. Now, as Sarah's due date approaches, she is dealing with the challenges of her environment, which is different, and also the realities of incarceration, which can take a toll emotionally and psychologically. I'm sharing this scenario to highlight a critical issue that is the importance of accessible mental health care for prenatal and postpartum individuals, particularly those in the justice system. So, an overview of the presentation, there will be a comparison and an information on incarceration and maternal health, mental health needs for the individuals, the role of trauma, barriers to mental health care access, some of the innovative solutions that have been brought up, and current legislative policies. So the first look is going to be on landscape of incarceration and maternal health. There is going to be a look on maternal health globally and what it looks like for the whole population, and then we will zoom in on the incarcerated population. So in 2021, the CDC reported increasing maternal mortality rates, and this was the peak or the highest point in which the maternal mortality rates were recorded for the United States. And it was 1,205 women who died of maternal causes, and that is a rate of 32 moms per 1,000 live births. Since then, with the initiatives of legislative policies and various healthcare organizations, there has been a decrease, and the latest data from 2023 shows that it has been 18 deaths or 18 moms who have passed away, unfortunately, per 1,000 live births. And for a country this big and also for a developed country, the US usually is known to hold a high maternal mortality rate. In 2021, CDC reported that the maternal mortality rate for white women was 1.4 times higher at a rate of 26.6 deaths per 1,000 live births. And this is in comparison to white women in our European or non-US countries. Among Hispanic women, it is 1.5 times higher at 28 deaths per live births. And among Black or African American women, it is 69.9 deaths, which is 2.6 times higher than the rate for white women. This is the latest data from CDC, where we can see that there is a difference in the number of deaths between Asian, Black, white, non-Hispanic, and Hispanic moms. And there has been a consistent disparity in the number of maternal mortality rates. Each of them can be contributed either to genetics, healthcare access, healthcare assessments that are being done in hospitals, and also leading back to environmental and social determinants of health. So moving into the justice-involved population, there has been a steady increase in the number of women being incarcerated in the US. In the 1980s, it was 26,000 approximately, and in 2022, the latest data shows that it's 180,000 approximately. And it is not universal. They have been divided into federal and state prisons. In federal prisons, there are approximately 112,000 women who are incarcerated, and in state prisons and jails, it's approximately 110,000. The importance of these numbers is that 3/4 of these women are of the reproductive age group, that is 18 to 45 years of age. And we have many nonprofit organizations and the Bureau of Justice Statistics that provide us with the various data that we can see in this graph. So maternal health in prisons and jails. The U.S. Government Accountability Office estimates that 4 to 5% of women entering prisons are pregnant, and this equates roughly to 12,000 pregnant women or postpartum women annually. Moreover, 80% of women in jails are mothers. Often they are primary caretakers. So this does impact their children because they do have a gap in care. This graph is from the Prison Policy Organization, and it shows even with the lack of data, a lot of nonprofit organizations and advocacy organizations are able to extrapolate data from what is provided in terms of numbers from Bureau of Justice statistics. And here we can see that 4% of women in state prisons were pregnant when admitted, and among them, 9% have not received an obstetric exam, 26% have not seen an outside provider, a prenatal specialist, or an obstetrician. 50% of them have not received any other prenatal care. For example, special testing, that is including the genetic testing, medication, or childcare instructions. So moving on to mental health needs. Globally, mental health issues prenatal and postpartum, we do see depression and anxiety affect the general population, maternal population, at a rate of about 10 to 15 out of every 100 pregnant women. There is 1 in 10 women approximation experiencing postpartum depression after giving birth, with some studies reporting 1 in 7. And it is also estimated that nearly 50% of these mothers with postpartum depression are not diagnosed by their healthcare providers. Imprisonment is known to exacerbate pre-existing anxiety, depression, or post-traumatic stress disorder and other mental health conditions. And according to the Bureau of Justice Statistics, 66% of incarcerated women report a history of mental health illness compared to 35% of men. Children born to these mothers may face attachment disruptions, heightening their risk of developmental and behavioral issues later in life. Approximately 43% of state and 23% of federal prisoners have a mental health history, with 27% of state and 14% of federal prisoners diagnosed with major depressive disorder. This is one of the commonest mental health disorder reported. Prenatal depression rates are often higher in incarcerated women, estimated at 50 to 70%, and this is far exceeding the 10 to 20% prevalence in the general population. Inadequate mental health care can lead to increased risk of self-harm and suicide among incarcerated mothers. Moving on to the role of trauma. Adverse childhood events is a form of trauma, and it involves various subdivisions to it. 90% of women within the criminal justice system have shown to have some form of childhood trauma. An adverse childhood event can include childhood abuse, neglect, family instability factors, and witnessing violence in the home. This is compared to 13% of justice involved men in the community reporting a history of childhood trauma. The increase of adverse childhood events are associated with higher rates of arrest, especially for women with mental health conditions. Ongoing systematic review papers suggest that these experiences, compounded by the stress of incarceration, exacerbate poor health outcomes, particularly during pregnancy. So, what are some of the barriers that these individuals face to accessing mental health care? This is a chart by the Prison Policy Initiative from 2024, August of 2024, and it shows in general, not particular to the female justice involved individuals, but it shows in general the mental health care access for these individuals. And we can see in yellow and in green the 33% of people with chronic mental health conditions have not had a mental health treatment, and 42% of people in severe psychological distress have not had mental health treatment. One of the common barriers is limited healthcare infrastructure. The US justice system is not set up to serve pregnant women and is, in a way, set up against them, and this might change in the future and is changing. There are several systemic barriers which hinder incarcerated pregnant and postpartum women accessing mental health care. They lack adequate prenatal care, and even fewer of them offer specialized mental health services. The National Commission on Correctional Healthcare highlights that incarcerated pregnancies are often at higher risk due to poor nutrition, mental health illness, and substance use disorders. The second barrier commonly seen is stigma and discrimination. Incarcerated women often experience discrimination from both correctional staff and healthcare providers. This discourages them from seeking help, and the discrimination or stigma attached to incarceration compounds any existing biases around mental health treatment, especially among women of color who are disproportionately represented in prisons. Inadequate mental health screening and diagnosis is another barrier for mental health care access for these women, with research and statistics showing that only 14% of incarcerated women who need mental health services receive them. This often leads to underdiagnosis, and that is because of lack of routine mental health screenings, which are necessary during the pregnancy and postpartum period, which can last up to 12 months after delivery. So, what are some of the innovative solutions that are currently being spoken about and that are looked at? The first one is trauma-informed care models. This has taken a lot of effort and movement by various representatives and also nonprofit organizations. It has been implemented in the UK for female pregnant and postpartum prisoners, where they use a trauma-informed care model to make sure that they are giving them the treatment and support that they need. So addressing gaps in mental health care for incarcerated pregnant and postpartum women requires a multi-pronged approach that prioritizes trauma-informed care, implementation of telehealth services to ease access, and have a cross-sector collaboration. One of the main points of importance is educating correctional staff and healthcare providers to recognize any signs of existing or past trauma and treat these women empathetically. As of 2017, a report from the Bureau of Justice Statistics noted that 54% of prisoners and 35% of jail inmates who had experienced serious psychological trauma or distress in the past 30 days had received no mental health treatment since admission. Addressing trauma uninformed practices that may re traumatize women, such as unethical practices like shackling during childbirth, also remain legal in 20 states, despite being denounced by the American College of Obstetrics and Gynecology. So, educating correctional staff and healthcare providers has been a point of improvement, especially in the state of Texas. And in 2019, the shackling law was banned in the state of Texas. Telehealth expansion for maternal mental health services. This has been brought about especially during COVID. We saw the benefits of this. So, implementing remote screening tools for postpartum depression and anxiety to identify high risk women early in the prenatal period, offering virtual therapy sessions, incorporating evidence based treatment such as cognitive behavioral therapy or trauma informed care, and establishing a support group, a virtual peer support group, which has been associated with reductions in postpartum depression. Lastly, having a cross sector collaboration. One of the main drawbacks of the current structure of the correctional facilities is the lack of a unified correctional system, but healthcare system as well. And this limited collaboration between state, federal, and public health agencies, for example, Medicaid centers and community-based organization, lead to a lack in continuity of care. So establishing a multidisciplinary task force to develop and monitor maternal mental health interventions in correctional settings is important. Having involvement of formerly incarcerated women in the program, having a focus group is essential to ensure the interventions reflect the lived experience of the target population, and having research grants and pilot interorganizational projects to evaluate innovative solutions that improve health outcomes as proposed by one of the very important bills, Justice for Incarcerated Moms Act of 2021. Lastly, moving on to legislative policies. The federal and state legislation has been taking into account various avenues for improvement. And since 2021, some of the bills that have been passed are the MOMS Act, the Black Maternal Health Momnibus Act, and Justice for Incarcerated Moms Act. Even though none of these bills were passed in their entirety, a lot of the issues were bundled together in various other bills and passed through that. The Justice for Incarcerated Moms Act was not passed, and it is being reintroduced for this congressional session. So, what is the Justice for Incarcerated Moms Act? This bill specifically speaks to using financial incentives for all states and local prisons and jails to end the practice of shackling pregnant individuals while giving birth. The bill also seeks to create a model program for incarcerated individuals in the perinatal period to have access to counseling and treatment for those who have been diagnosed with mental and behavioral health conditions. These include trauma and substance use disorders. The bill also states a grant program through the Bureau of Justice Assistance to improve maternal health outcomes for individuals in state and local prisons and jails. In Texas, we have a lot of legislative bills that have come into acts and that are also being discussed, focusing on maternal health for incarcerated women. The Texas Jail Project has advocated extensively for legislative protections for pregnant people, which has resulted in a wide range of laws, starting from basic data collection on pregnant population in county jails to the banning the use of restraints during labor and delivery in 2019 to mandatory OBGYN care and transfer to hospitals during onset of labor and improved access to mental health care. Some of the bills and acts that are of importance are the bill that required TDCJ to provide comprehensive prenatal and postnatal care for incarcerated pregnant women, and it also emphasizes mental health services during and after pregnancy. The bill that proposes provisions for training staff to support these pregnant women. This was reintroduced in 2021. The act that was passed in 2019 that aims to establish pilot program for prenatal and postpartum care of incarcerated women, addressing the specific health needs of mothers in the criminal justice system. And in 2021, the act that includes measures for ensuring proper nutrition and healthcare access to pregnant incarcerated women, acknowledging the critical role of maternal health during incarceration. And those are my references. And thank you.
Thank you so much. Those were very hard statistics to hear, but I am really glad that you're working on it. And thank you so much for including the legislation that's been passed. Do you happen to know about um, any bills right now that are in progress that we can support for incarcerated women?
Yes, the Justice for Incarcerated Moms Act is being reintroduced for the 2025 legislative session. And it
Okay,
is in the House right now when I last checked.
perfect. Thank you. And if anybody else has questions, please feel free to come off mute, or if you want to put them in the chat, then I can read them. That was really enlightening and just hard to read and hard to think about.
Thank you. It is a difficult topic, but it is being
Mhm,
addressed. I think that is why I wanted to include the legislative part as well, because it is being addressed since 2021, and especially in the state of
mhm.
Texas, there has been work going on since 2008 with nonprofit organizations and the health department as well.
Great. That's great to hear. It's hard enough being pregnant. I can't imagine being incarcerated and not getting the care you need on top of it.
What really surprised me was the extent of incarceration, because if you get a speeding ticket
Yeah.
and you're in there when you are pregnant for some reason, even if it is for a month or two, the amount of mental stress that goes on
Mm,
um, with that situation.
right. You mean like while they're trying to get bailed out?
Yes, yes, because this involves
Yeah.
being in the county jails, and
Mm-hmm.
that's also part of the system. And that is one of the main asks from some of the organizations in Texas, where they want to see the numbers of people in county jails and if there is a way to improve access for healthcare for them.
Mm-hmm. I got a couple questions. One was, how is this work being impacted by any current executive orders? And if not directly impacted, are the cuts to funding a potential to impact the work?
Um, I will say for the first question, yes. There has been a little bit of a pullback in terms of some
Mhm,
nonprofit organizations, but they are trying to find funding in other ways, and they're keeping track of the current bills that are there in the state legislation as well as at the Senate in the federal legislation, and they're trying to make sure that some of the parts of the bills, even if they cannot be passed or cannot be supported as a whole, can be attached to a different bill so that there is no lack of advocacy or work that they're doing.
mhm. It looked like the second question is about the same. Yeah, it's about all the cuts happening across the state. Will that have a direct impact? Yeah. Um, and then I was wondering, did you have you compared privatized prisons versus public prisons?
No,
I was
because the
wondering if,
data, it gets a little tricky when you go down there to compare the data, because if it is a private
mhm.
prison, they do have data, but it's not publicly accessible. Um,
Hmm, that's another problem.
yeah. Most of the data is from Bureau of Justice and Statistics, Justice Statistics, because they are the ones who have questionnaire that they usually fill out and file. And I think they recently released the 2022 report.
Mhm.
Um, so they're the ones that I usually seem to follow.
Okay. Oh, cool. Yeah, I don't think we have other questions. I thought I had another one, but gone now. um, wow, yeah, I really enjoyed your presentations. So enlightening because, you know, you just don't think about it all the time if it doesn't
Yeah.
affect us. Yeah. Um, well, I wanted to let everybody know that you will be getting an email if you're needing chess credits. With a link to fill out the survey. Please complete the survey and make sure you put your chess or MChess number to get credit. Um, and Martina, thank you so much for sharing this information with us. I'm going to try to find the actual bill number for the Justice for Incarcerated Moms Act so that if anyone wants to reach out to their representative and support it, you'll have the number. And yeah, any last minute questions before I let everybody go? Uh, Carlton said this was a very informative presentation, and he said thank you. Mm, yeah, it was great. Thank you very much. I really appreciate somebody doing all this work and gathering all this information for us.
Of course, I really
Thank
appreciate
you.
the opportunity to present. I was really happy that you guys were interested. Thank you.
Yeah, absolutely. Of course. This is we are definitely trying to, bring awareness to things that we can support in the legislator or, maybe call attention to and not support if they're bad bills. So thank you so much for letting us know about this. And yeah, we had another comment, very somber to think about, but thank you for sharing. Oh, one question. Let's see. Is this something the state is supposed to take care of, or does it fall on nonprofits?
So that is one of the reasons why the system's not set up for it.
Mhm.
Like back in 1980, there were 26,000 moms, and it's not just in one sort of incarceration system. It's spread across federal, state, and county jails. So the system hasn't been set up in a way that outpatient care has been set up. It's usually for inpatient, you do receive care, especially in federal prisons, but it's not specifically designated. It depends on state to state. Some states
Mhm.
have Medicaid expansion, have different accessibilities, and have different pathways for care there, and some don't. So it's not one or the other.
Yeah. Okay. Well, thank you. Yes. Oh, I also got one comment. This will continue to exacerbate the already existing gaps in maternal mortality amongst marginalized groups. Yeah, absolutely. Oh, yeah. Sorry. And the statistic on how many had experienced childhood trauma, just, it's heartbreaking. Thank you. Um, well, thank you so much for joining us. And yeah, you're welcome to come back anytime and share your information with us.
Thank
So,
you.
all right. Have a happy Wednesday, everyone. Bye.
Bye.